There cannot be treatment success if the patient with fibromyalgia does not commit to self-managing. Today we will be talking about how fibromyalgia is treated, and there's going to be a lot of useful things for the patient to know and to learn, and we'll go right into them one after the other. First, I will go over the principles of management of fibromyalgia, and while doing this, I will highlight the steps that individual patients can do on their own, and generally speaking, that they could have in mind to work with their physicians in getting achieved. And hopefully this is going to help them significantly in making progress in their self-management. The first principle of successful treatment of fibromyalgia is to commit to self-management. The patient has to be willing and to be aspiring to do the best they can in getting better, not just hoping that other people will help them get better. Now, consciously committing and making efforts to help themselves goes a long way in helping them achieve the progress that they so much need. A lot can be achieved when you work conscientiously with your health caregivers, but also depends on yourself, because there will be a lot that you have to do on your own at home in your private times that would help you get better. Flare-ups will come irrespective of what you do at intervals. When they do come, things you have learned before then will help you cope better so that you do not crash emotionally, and this goes into vicious circles and you get more flare-ups and more emotional crashes. So the first principle is to commit to self-management and be willing to take up a big mantle of leadership in self-treatment. Number 2, acquire necessary education about fibromyalgia. Every patient will in time learn more and more about that condition because it is essentially lifelong. It does not go away. And the sooner the patient commits to understanding the disease better, the better for them, because this will allow them to appropriately conceptualize what is going on in their body at every time. And that way, they will not be using the wrong interventions that will not help them and probably cause them more harm. Therefore, committing to acquiring as much knowledge as necessary in understanding what is going on is a vital part of managing the disease appropriately. And this is one of the reasons why it is important to get diagnosed. There are many physicians who still believe in the difficulty of being certain about the diagnosis of fibromyalgia. And some people actually argue that maybe patients should not be given the label of fibromyalgia even if they do fulfill the criteria for it. I totally disagree with this. Modern science disagrees with this. So, patients should be diagnosed if they have fibromyalgia, and this will help them committing into a journey that helps them understand the disease better and treat themselves better and manage the disease better. A lot happens and evidence exists for it to say that people actually do better when they know they have the formal diagnosis, and they are less likely to do unnecessary tests, some of which can be invasive and potentially harmful. Number 3, a combination of pharmacological and non-pharmacological interventions will be necessary. Every patient needs to understand that you cannot rely entirely on just drugs to manage the entirety of the symptoms of your fibromyalgia. Drugs can help, painkillers can help, not all of them, but drugs alone cannot fix the patient. In fact, I don't think there is any single intervention for fibromyalgia that takes it all away. So, the typical patient requires a combination of necessary medications with non-medication interventions such as things like mindfulness, acupuncture, tai chi, yoga, and so on and so forth. These things that do not have anything to do with drugs also have their vital places. And let's not forget the crucial role of paced exercise. Evidence has consistently shown that many aspects of fibromyalgia can improve with graded exercises. Now, I know this sounds very counterintuitive. When a patient feels tired and feels sore and they're being told exercising more is what is going to help them, the rule is take it slow and build it up. Pace yourself. If you do not overdo things, you stand a good chance of being able to do more over time. But if you overdo too much and you go into a flare-up, you'll be discouraged and you lose motivation for doing more in the future. Number 4, combination of conventional and complementary medicines may be necessary. Now, we've already mentioned that the role of painkillers can be important in the management of fibromyalgia, particularly when an intense flare-up is going on. The patient may require some painkillers that will help them cope better in that period. Now, in addition to this, some complementary medications can also be of benefit, and various patients have found various supplements useful for them. Some people have tried things that contain magnesium, things that contain calcium and vitamin D, and so on and so forth. Now, it's important to say that none of this is an approved treatment specifically for fibromyalgia. But we also know that the understanding of fibromyalgia is very limited. It is not just a made-up thing. It is not just in the head. There's actual neurological changes in fibromyalgia. They are not structural, but they are happening in the brain in the way the central nervous system processes pain, thereby leading to exaggerated perception of pain, where there is nothing provoking the pain in the peripheral body. Therefore, it is not always clear how some supplements can be of help, but some patients have found various supplements beneficial. There is no consistent evidence along this line, but if you have somebody who has found a certain supplement helpful at the time, there's probably no harm as long as it is a proven supplement that is not harmful to the body. In essence, there could be a role for a combination of conventional orthodox medications and some supplements and as necessary. Lastly, it is crucial to separate and properly manage the symptoms of coexisting illnesses that are not fibromyalgia. Now, I cannot stress this enough. Many patients with fibromyalgia have so many other conditions going on in their body at the same time. There are patients with fibromyalgia also have rheumatoid arthritis. There are patients with fibromyalgia who have psoriatic arthritis, lupus, and so on and so forth. Not mistaking the symptoms of the other conditions for that of fibromyalgia is crucial, such as not to be chasing the wrong thing and failing to treat a treatable inflammatory condition and assuming that everything is caused by fibromyalgia. On various fibromyalgia support groups, you see people who have more sinister conditions who attribute everything to their fibromyalgia. Not appropriately treating other aspects that can lead to a flare-up will make everything seem worse. Everybody knows that if a patient with fibromyalgia has any other simple illness, such as catching a flu, everything can feel a lot worse for them than it does for the regular person. In that situation, it will be good to not only manage the symptoms of the flare-up of the fibromyalgia, but to also carefully and properly manage the symptoms due to the primary disease, which could well be aggravating a flare-up of fibromyalgia. So that's it today in today's short video. I hope these 5 principles will be very useful for you as an individual in the fibromyalgia journey. This is something that every patient needs adequate and proper support. It does not go away, and adequate support and proper understanding of their condition goes a long way in helping individuals cope better. If you like this video, please kindly like it by clicking the like button. And it is also going to be of benefit to me if you consider subscribing to this channel and see many more videos related to this kind of content. Thank you.